Can anyone tell me what this is? Come on, ladies. Right, it's an earring hook. Now, what is an earring hook used for? Right, to most people, the only use of an earring hook is to keep your ears looking fabulous. But to the millions of microbes living on your skin, something as small as an earring hook could be the perfect vehicle to travel from host to host. Now, I went through a similar thought process when I was in high school and found through my own experimentation that on this one earring hook, there are enough bacteria to colonize an entire petri dish the size of the palm of your hand. Now, I'm not trying to gross you out. Most of the time, these undetected hitchhikers are harmless, and it's sometimes even beneficial. However, under certain conditions, lack of awareness could lead to some nasty consequences. And in hospitals, lack of awareness could lead to someone's death. Antibacterial copper is a viable solution for the pandemic that is hospital-associated infection. Today, we will explore the issue of HAI, as well as the cause, and how the addition of antibacterial copper in healthcare facilities can limit the number of HAI contracted. So let's take a closer look at the problem of HAI and its effects not only on our lives, but on our global community. So how many, by show of hands, how many of you have ever been in a hospital? All right, how about visited a relative or friend in a hospital? Hospitals are communal areas full of thousands of people with weakened immune systems. That makes it the perfect environment for something like our normal bacteria to become something a little bit more dangerous. HAI is a global dilemma. From Rudel and Weber's 2004 study, we learned that on average, contraction of HAI leads to 19 extra days in a facility. We also learned from Antibacterial in 2011 that $47 billion and 100,000 lives are lost yearly to HAI. HAI happens when a patient, caretaker, or visitor contracts an infection within a healthcare facility. The naturally weakened immune system of patients make them particularly susceptible to this kind of infection. Schmidt in 2012 tells us that you can not only contract an infection from hand-to-hand contact, but also from contact with communally touched items. In 2004, we learned from Tortora, Funk, and Case that bacteria can not only survive on our skin, but also on plastic, stainless steel, and wood surfaces. This means that in a poorly controlled environment, an already ailing patient could contract a deadly infection simply from flipping the channel on their remote control. So should you be afraid of going into a hospital? Of course not. The CDC, or the Center of Disease Control Prevention, has set up numerous procedures to guard us from this threat. However, it still remains that 100,000 people lost their life last year to something as silly as someone forgetting to wash their hands. The cause of HAI is all around us, and so the solution seems simple. But it's actually the commonness of the culprits that makes this pandemic so difficult to check. Bacteria is part of our everyday life, and when our immune systems are working, they pass unnoticed. But patients are constantly undergoing procedures and surgery that puts them at risk from contracting unfamiliar bacteria and their bacteria becoming infectious. We've probably all heard of staph. Staphylococcus aureus is probably the most common bacteria found on our skin. We learned from Hull in 2008 that it's the sturdy cell wall of this bacteria that allows it to survive the changing environments of our skin. Something as small as a paper cut could be enough for this bacteria to gain entry to our bodies. In Toland's 2013 article on Medscape tells us that HAI due to staph has increased in the past 20 years. Infections caused by staph include, but are not limited to, scalded skin syndrome, toxic shock syndrome, pneumonia, and deep tissue infection. Now, I was originally going to show you a picture of each of these. However, I found them so gruesome that I chose to just show one. This is a patient suffering from toxic shock syndrome. While only his hands are pictured, you can imagine what the rest of his body looks like. So, if we know where HAI is coming from, why aren't we doing anything to stop it? The truth is we are. According to Garner and Favreau's 1986 review, the CDC has been working on a protocol to address HAI for the past 35 years. However, Trick and his colleagues 2007 tell us that not all healthcare facilities strictly adhere to this policy. And in fact, they rarely adhere to hand hygiene. Also, the CDC requires that commonly touched surfaces, which are suspected reservoirs for pathogens that cause HAI, only be cleaned and not disinfected. The current methods are flawed. They require no human error, which is not practical. Something must change. I propose that we replace commonly touched surfaces, such as bed frames, doorknobs, and IV poles, with copper to reduce the probability of human error causing needless death. Antibacterial copper has naturally bacterial-killing properties. While research is still emerging on the cause of this, there is overwhelming evidence that it is the copper's capability of interfering with the bacteria's energy production that allows them to die. This is actually a picture of Dr. Schmidt, who's working on more research in this. I worked with him very closely my senior year of high school to better understand this process. He tested his hypothesis by replacing commonly touched surfaces in healthcare facilities and monitoring their microbial burden for about 2 years. And he found that on average, the copper surfaces had 83% less bacteria at the end of the 2-year period. And when compared to stainless steel surfaces, they had 96.8 less bacteria. By replacing commonly touched surfaces with continuously killing surfaces and conditioned to the protocol that we have, HAI could be reduced and lives could be saved. What we're doing right now isn't working. Human error is unavoidable, and the cost of life is unacceptable. Antibacterial copper would address these unseen reservoirs in a way that would be easily maintainable by hospital staff. If a nurse misses a spot on a bed frame, then the antibacterial copper will take care of those deadly pathogens before a patient has a chance to interact with them. Less bacteria means less HAI, and less HAI means less needless loss of life. However, without public awareness and support for antibacterial copper, nothing is going to change. In conclusion, I'll leave you with this. When the swine flu outbroke, the media echoed with precautions. You always hear about fundraisers for AIDS or breast cancer awareness, but you never hear about any charities for HAI. HAI is an under-publicized pandemic, and it costs billions of dollars and thousands of lives each year, and we can prevent it. I propose that we replace commonly touched surfaces in healthcare facilities with antibacterial copper to address these reservoirs and reduce the amount of pathogens in those facilities. HAI does not have some amazing cure or some strange origin. It's on this earring hook. It's on the doorknobs. It's on your skin. You interact with it every single day of your life. It's not very interesting, and it's not very fun to think about. But HAI springs from a component of our bodies, and it's our responsibility to check it. Thank you.